Welcome to Conversations about Weight Management. This learning module has been created for everyone working in healthcare, including registered healthcare professionals and support workers, such as Whanau Ora practitioners, Maori health providers, and lead maternity carers. At the end of this online learning module, you will know how and when to use these tools to support effective weight management. It's hard to stay a healthy weight, surrounded by ads for energy-dense food that's quick to grab and designed to taste good. Children are especially at risk of affecting their future health, and it's hard to know what advice to take. This learning module will help you discuss and manage weight with anyone who needs support. So why is weight management so important? Putting on weight can affect quality of life and brings a higher risk of poor health. As a person's body mass expands, they are more likely to suffer from depression and sleep problems. A significant weight increase can cause type 2 diabetes, cancers, and other major health issues. Being overweight affects an individual and their whanau. It makes it harder for them to get out and be active, and lowers life expectancy. Being overweight should be preventable. With simple lifestyle changes, we can all take control of our weight and well-being. Support is important for weight management. Asking for help from whanau or friends is part of the process. Be aware that people may have different opinions on body image, food, and weight. Friends and family may be used to seeing people as a particular size and shape. If this changes, even for the better, they may make unhelpful comments, and it's important not to get discouraged. Many overweight people have tried to lose weight, usually through shrinking their overall diet. This makes them feel starved and deprived. Then the weight goes back on once they start eating normally. Shrinking the good along with the bad is not the answer, as it's neither healthy or sustainable. There are many reasons why weight management can be difficult to discuss. For the patient, this might be embarrassment about their size or lack of self-belief. For the health professional, this might be difficulty managing their own weight, lack of confidence starting a conversation about weight, or scales that don't record a high enough weight. Before you start a conversation about weight management, consider your own views and assumptions. A non-judgmental attitude will create trust and lead to better outcomes. Healthcare workers will be familiar with the ABC approach for smoking cessation. We're now introducing the ABO approach for weight management. The first two stages of ask and brief intervention are the same, with O for ongoing management and referrals. The ABO approach focuses on asking individuals and their whanau if they have any concerns, then finding out the reasons behind a person's weight gain. Weight distribution varies between men, women, and different ethnic groups, and requires different approaches to nutrition and exercise, which we'll cover later. It's important you understand about weight distribution, otherwise you can give people the wrong advice and set them up for failure. Many people find it hard to talk about their weight, so look for opportunities to start a conversation. This is the Bennett family. Mr. Bennett has come in as their son is complaining about a sore throat, and you notice Dad's weight is a little high. After sorting out the sore throat, you can use these two validated questions to initiate a conversation about weight management.
Are you concerned about your weight or shape? Are you concerned about your eating patterns or control over eating?
If the answer is no to both questions, then you should respect that they may not see a need or feel ready to address their weight at this time. Don't judge. Remain understanding, compassionate, and supportive, even if you think they should be concerned about their weight. Ask their permission to ask again, and extend an open invitation to return at any time. You can also give them handouts with simple, healthy lifestyle messages that everyone can benefit from.
Feel free to come back at any time if you want to talk more.
However, if one or more of the answers is yes, then you can continue onto the brief intervention stage.
Do you mind if I ask again in a year's time?
Sure, no problem.
Great. Take these leaflets, but feel free to come back at any time if you want to talk more.
This is a great time to introduce some small and simple steps that can make big changes to overall health. The 3 key messages are: eat more veggies and fruit, drink more water, move more. This simple advice is healthy, sustainable, and should result in weight loss. Encourage people to start slow with exercise and notice how moving even a small amount helps improve their mood. It's important to take baseline measurements so you can track any health and fitness changes. Ideally, you should check their daily intake of vegetables and fruit and time spent on exercise, especially activities that make them huff and puff. If you're working in a general practice or healthcare facility, then you should also measure their weight, waist circumference, blood pressure, and take blood samples to check inflammatory markers. Some people may be concerned about their weight or shape, but are not willing, ready, or able to make changes. Here are 2 questions you can ask to check their readiness and determine the next step along their pathway.
1. Considering all outside factors at this time in your life, stress you're feeling at work, your family obligations, how confident are you that you'll stay committed to an improved eating pattern? 2. Compared to previous attempts to change your eating, how motivated are you to improve your eating at this time?
If they score 5 or below, then they may not be ready to change at this time, so invite the patient to come back when they feel ready. At this point, you can use a technique called motivational interviewing to continue the conversation. This means listening, asking open-ended questions, and reflecting on what they tell you. If you don't hear any change talk such as "I could" or "I should," then don't offer solutions, as this can create more resistance.
I was planning to lose weight, but I just haven't got time.
Saying "but" is a clear signal the patient doesn't feel heard, so more reflection is required to show that you are listening.
It sounds like you have a lot going on right now, but I hear weight loss is important to you.
Yeah, I know I should, and I need to find the time.
Well, let's talk about what's important to you.
If people score 6 or more, complete a comprehensive assessment form with them. People with scores of 6 or more are far more likely to attend appointments and make positive changes to their lifestyle.
So it looks like now is a good time for you to make some lifestyle changes.
Yeah, I think I can.
OK, let's do an assessment to see what we might want to focus on first.
This is an ideal time for you to stop and fill out your own comprehensive assessment, and you can use this tool in your own practice to show areas to focus on. The comprehensive assessment form is based on Te Whare Tapa Whā and provides a holistic overview and insight into why people may be overweight. Te Whare Tapa Whā is one model of health which reflects a Maori worldview, based on the concept of a whare, held up by 4 pillars of health. Wairua, beliefs. Whānau, family. Hinengaro, mental health. Tinana, physical health. The form is available online and may be completed at home. The results can then be reviewed at the next appointment. Completing the comprehensive assessment will also help with goal setting. Often people know what needs to be changed, but need help writing an action plan. Your role is to enable them to manage their own weight, in their own space, and at their own pace. Smarter goals focus on realistic actions and steps. These are specific, measurable, action-oriented, realistic, timely, and agreed. Remember to create goals with people, not for people, and to write them down. A personal plan of action to use in your practice is provided at the end. Focus on actions such as eating 3 servings of colourful veggies with dinner 5 nights a week, or going on a 20-minute family walk twice a week.
So what changes do you plan to make in the next 4 weeks?
Well, I reckon I could swap my fizzies for water and add more veggies to my dinner.
Great! Let's write that down in your personal action plan. Remember to write down how many handfuls of vegetables you're going to eat.
The ABO approach is not just about weight management, it's about improving overall health. You can measure improvements in other ways, such as feeling better, looking better, sleeping better, and having more energy. The ongoing management stage requires regular reviews to support people in making lifestyle changes. Some people may need more frequent visits at first. Then you can space out appointments. Think about if there's any funding available in your region. Some people will also need onward referrals to specialist support services based on the results of their comprehensive assessment. These could be self-management groups, smoking cessation, dietitian, community or marae support, counselling, or green prescription, whatever is available in your area. Take measurements at every visit and review against previous results. If you're working in general practice, then repeat any abnormal blood tests. Use positive language to reinforce healthy diet and exercise messages, and help people adjust plans as they make progress. Celebrate success and congratulate any attempts or changes made. Focus on improvements no matter how small to support self-belief. Use motivational interviewing to ensure people feel heard and continue to offer ongoing support. A common cause of poor nutrition is eating too much highly processed food and not enough nutrient-dense, wholesome, real food. Highly processed food and takeaways are often more expensive and contain less nutrients than meals cooked from real food. Encourage people to eat more nutrient-dense, real food and less labels for overall health and weight management. One good tip is stick to the outer edges of the supermarket, as highly processed foods are usually found down the centre aisles. It's also better to buy a variety of healthy, real food than spend money on supplements. Eating protein makes you feel fuller for longer, as it satisfies the appetite. Another great tip is to choose more colours and eat less beige food. Adding more colour to your plate means there is less space for highly processed food. We should all eat at least 5 portions of veggies and fruit each day. The ideal level for good health is 9 portions, with more veggies than fruit. Vegetables can be fresh, canned or frozen, and encourage people to choose vegetables that grow above the ground. Water is the best drink for good health. Try adding a slice of lemon, keeping bottles in the fridge and taking a water bottle to work. Plain milk is another good option. Fizzy drinks, including diet, are not recommended, as they're acidic and can cause tooth decay. Added sugar can be hidden in many highly processed food and takeaways, as well as juice, cordial, flavoured milk and fizzy drinks. Look out for added sugar in breakfast cereals, flavoured yoghurt, sauces, muesli bars and pre-made dinner sauces. Read the ingredient panel on labels. If sugar or sugar alternatives is one of the first ingredients, then it's probably not a healthy choice. Alcohol is full of empty calories, especially when combined with sugary mixes. Drinking alcohol makes you more likely to eat unhealthy food and contributes to weight gain. If you drink alcohol, have no more than 1 to 2 standard drinks a day and have at least 2 alcohol-free days a week. Fats are essential for life, and it's best to eat fats and oils from real foods such as nuts, seeds, olive oil and avocados. Try and eat oily fish twice a week, rather than taking a fish oil supplement. If you eat meat, then remove any large visible areas of fat before cooking. Apple-shaped people with weight stored around their middle will find it easier to lose weight than pear-shaped people, who store weight on their hips, bottom and thighs. Central weight is more dangerous than peripheral weight. This is because weight can be stored in and around vital organs, increasing the risk of diabetes, heart attacks and strokes. Losing peripheral weight is more difficult. Very low-energy diets may help lose this weight, but must always be done under medical supervision. Exercise brings many positive benefits. However, it may be uncomfortable for some people to exercise, so help them to find ways to add simple resistance training into their daily life. People not used to exercise should start slow and gradually work up to 30 minutes or more a day. It may be easy to break this up into smaller, snack-sized sessions of 10 minutes. Resistance training helps muscles become metabolically active, improves strength, and doesn't have to be done in a gym. Simply standing up and sitting down. Doing press-ups against a wall or step-ups on stairs will get results. Help look for simple ways to add a little huff and puff into their everyday life. And anything that increases heart rate, breathing rate and temperature will be of benefit. It takes 6 to 8 weeks for the body to adapt, so it helps to add some variety to exercise every couple of months. As we mentioned earlier, weight distribution can vary, and this requires a different approach to exercise. Pear-shaped people with a lot of peripheral weight, especially in the lower limbs, can suffer from joint problems. They require lower impact activities to reduce the risk of injury. Apple-shaped people who are centrally overweight should gradually increase the intensity of physical activity and need to continue at a higher intensity to maintain good health. You can find more resources to print and hand out at the Bay Navigator Pathway website. You will now be given a short online test with a certificate to print and save at the end. Thank you for watching Conversations about Weight Management.